let's talk about what could be a truly revolutionary new way to fight cancer. It's a technology that takes the single most powerful form of radiation you can imagine and instead of shooting it at a tumor, it unleashes it from the inside out.
And to see what that means, I want you to meet Cyril. He was dealing with a recurring skin cancer. It had already been treated twice. But the third time it came back, it was right next to his eye, growing into his eyelid, his tear duct. The only standard option left was this massive surgery that came with a real risk of disfigurement. And his biggest fear? Losing his sight.
But instead of that surgery, Cyril was offered a new experimental therapy. And after just one treatment, his tumor was completely gone. So, the question is, how on earth is that possible? What is this technology that can do something like that?
Well, to really get what makes this such a breakthrough, you first have to understand the basic challenge with radiation therapy. We all know it's incredibly powerful at killing cancer cells, right? But the problem has always been that it can be, well, a little imprecise. It risks damaging all the healthy tissue that's sitting right around a tumor.
Here's a good way to think about it. Conventional radiation, that's beta and gamma rays, it's kind of like shooting bullets. They travel far, they can go right through walls, and that long range is exactly what creates the risk of collateral damage. But alpha particles, they're not bullets, they're cannonballs. They have this immense cell-shattering power, but they're so big and heavy that they literally can't even get through a single sheet of paper. In your body, the range is just a few microns. We're talking less than the width of a human hair.
And that right there is the big puzzle. Alpha particles are by far the most powerful form of radiation we have, but their ridiculously short range has made them pretty much impossible to use for treatment. You can't just fire them from a machine. So for decades, this has been the central challenge.
And this brings us to the absolutely ingenious solution. It's a technology called alpha-DART, and that stands for Diffusing Alpha Emitters Radiation Therapy.
So instead of trying to fire these cannonballs at the tumor from the outside, alpha-DART does something completely different. It puts the cannonball factory directly inside the tumor. They insert these tiny radioactive sources, and those sources release atoms that spread throughout the cancer, firing off those high-energy particles from within. It's a total flip of the script.
Okay, so here's how it works, broken down into 4 steps. First, these tiny little seeds, coated with a radioactive element called radium-224, are placed right inside the tumor. Step 2, as that radium decays, it releases these new, smaller atoms. You can think of them as daughter atoms. And these atoms start to spread out, diffusing into the tumor. Then, step 3, as those daughter atoms travel, they fire off the big guns, those powerful alpha particles, destroying the DNA of any cancer cell in their path. And finally, after about 2 weeks, the seeds are harmless and they're just taken out.
The science is brilliant, no doubt about it. But the only question that really matters is, does it actually work in people? So let's take a look at the results from the first human trials.
In the very first U.S. pilot study, for patients just like Cyril, people with these really tough-to-treat skin and soft tissue tumors, the result was, well, it was kind of stunning. 100% of the patients had what's called a complete response. That means at their 12-week follow-up, their tumors were visibly gone.
Okay, so it's effective, but what about safety? I mean, this sounds intense. Well, in that same study, you know how many patients had serious systemic side effects? 0. None. The treatment wasn't just incredibly effective, it was also remarkably easy for patients to tolerate.
And the reason for that amazing safety profile goes right back to the physics we just talked about. Because those cannonballs don't travel far, all that destructive energy stays almost entirely inside the tumor. This spares the healthy tissue around it, and this part is absolutely crucial as we're about to see, it also spares the body's own immune cells that are hanging out around the tumor, ready to fight.
And this led to what might just be the most exciting discovery of all. Researchers started to notice that by treating just one tumor, alpha-DART could sometimes trigger a body-wide immune response against that person's cancer.
Let me just frame this with a question that sounds like it's straight out of science fiction, but this actually came out of a real clinical trial. Is it possible that treating a tumor on one leg could make a totally separate tumor on the other leg just disappear?
Because this really happened. This was a case from a trial in Italy. A patient had tumors on both of his legs. For some logistical reason, the doctors could only treat the tumor on his right leg that day. When they came back a month later to treat the left leg, they found its tumor had vanished. It was gone.
Now, the radiation couldn't have traveled from one leg to the other. There was only one possible explanation. Treating that first tumor had woken up the patient's own immune system, which then went out and hunted down and destroyed the second one.
So, they tested this idea in the lab. They took mice and cured them of colon cancer using alpha-DaRT. Months later, they re-injected those same mice with that same aggressive colon cancer. And as you can see, their bodies immediately recognized it and wiped it out. No tumors grew. But then, they injected them with a different type of cancer, breast cancer. Their bodies didn't recognize that one, and tumors grew like normal. It proved the immune system had developed a specific, lasting memory, almost like it had been vaccinated against that first cancer.
So what does this all mean? It means that by completely obliterating the tumor with this super intense, localized radiation, alpha-DaRT seems to expose all the wreckage of the cancer cells to the immune system. It's like it's training the body's own defenses to recognize that specific cancer as a major threat and then hunt it down anywhere else it might be hiding in the body.
Which leaves us with this one final, really profound thought. This whole technology started as a clever way to solve a physics problem, how to deliver radiation in a very precise way. But it may have accidentally unlocked something so much more powerful, the ability to turn a patient's own tumor into a personalized cancer-killing vaccine, essentially creating a factory for its own destruction. And if that's true, it could change absolutely everything.